I welcome second speaker, Dr. D.S. Meena. He is going to deliver a presentation on the diseases of zoonotic importance with a special reference to brucellosis. So Dr. Meena is working as an associate professor and head department of veterinary medicine, and also in charge of veterinary clinical complex, postgraduate Institute of Veterinary Education and Research, Jaipur, Rajasthan, India. He has more than 20 years of experience of teaching, research, and extension in the field of veterinary medicine. He is also working as a principal investigator, Center for Diagnosis, Surveillance, and Response to Zoonotic Diseases, and also handle many projects funded by various national and international agencies. He has guided many PhD and PG students in the discipline of veterinary medicine. He has more than 33 publications to his credit, published in national and international journals. He authored 2 books in veterinary science, and he attended various international and national conferences and presented papers. Now he is holding a post of Vice President, Veterinary Internal and Preventive Medicine Society, and also he is a life member of many scientific societies and forum. So I welcome Dr. D.S. Meena sir, and I request to present his topic on diseases of zoonotic importance with special reference to brucellosis. Dr. Meena sir, please.
Thank you very much, sir. The slide share is on. Thank you very much, sir. First of all, I will welcome and thanks to the chief guest of today's function, Professor Dr. Gentil sir. He's really presented very well and very informative presentation. Thank you very much, sir. And now I'm also thankful to the dignitaries of the MAPSU, especially Dr. A.U. Bikane, Associate Dean and coordinator of this program also. I'm thankful to you, sir, also. You have provided such a good opportunity to me also. I'm also thankful to all the dignitaries of the MAPSU, especially all the representatives, all the participants who are participating in this international webinar or a training of 7 days. It's really a very informative and very good for the professionals. So my thanks to all, especially the Bagmore sir and other dignitaries. I'm also thankful to the Alembic Pharmaceutical. Mr. P. Karunanidhi is also always available for all these activities. So thank you, Dr. Karunanidhi and Dr. Sinde. So friends, today I will discuss about the diseases of zoonotic importance with a special reference to the brucellosis. A warm, very good evening to all of you. I am Dr. D.S. Meena, Associate Professor and Head Department of Veterinary Medicine, Postgraduate Institute of Veterinary Education and Research, Jaipur, Rajasthan. It is a constituent institute of Rajasthan University of Veterinary and Animal Sciences, Bikaner. So friends, in introduction, we all know that when animals fall ill, the owner has a problem because many owners depend on their animals for income. We all know. So my mean of this here to elaborate it, if a sick donkey, for example, cannot pull the cart to bring fruits to the market, there will be no income for his family also. Or we can say if a sick chickens stop laying eggs, there will be no eggs to sell. And without any money, how can sick animals be treated or replaced if they die? So it is our moral duty as a custodian of the this profession. We always keep in mind that our animals will become healthy and be healthy. Some animal diseases can spread to the other animals, making the problems even bigger. We all know that. Even worse still. The diseases can also spread to humans. In past years, much publicity has been focused on the mad cow disease, as Professor has also discussed, and even avian influenza. While these zoonoses are described as a serious threat to the human health, many other zoonoses cause more death among the people and get far less attention, like rabies, for example. We know that because of the rabies, there are around more than 50,000 people worldwide die every year. While in comparison to the BSE, we know that only more than 100 or 139 people between 1996 to 2002 died because of the BSE. And in human death due to the avian influenza have been amounted no more than 200. So friends, many of these zoonoses can be entirely prevented. It's a question. So to prevent these diseases from the occurring in humans, we will also, as far as possible, need to prevent them occurring in animals. As we all know, the definition of the zoonosis, the word zoonosis was introduced by Rodolphe Virchow in 1980, and to include collectively the diseases shared in nature by man and animals. And after that, later on in 1959, World Health Organization defined the zoonosis as those diseases and infections which are naturally transmitted between vertebrate animals and man. So the zoonosis include only those infections where there are either a proof of a strong circumstantial evidence of transmission between animal and man. It is the friends, we all know that this zoonosis is not a problem of any state or even any country. It is an international problem. So the historically zoonotic diseases had a tremendous impact on the evolution of man, especially those cultures and societies that domesticated and bred animals for food and clothing. Zoonoses are among the most frequent and dreaded risks to which mankind is exposed. So the zoonosis occurs throughout the world, transcending the natural boundary. So it is really an international problem. As an international problem, their important effect on the global economy and health is well known, extending from the international movement of animals and importation of diseases to ban on the importation of all animal products and restrictions on other international trade practices. So zoonosis no longer are solely a national problem. For effective control of zoonosis, global surveillance is necessary. So with recognition of the interrelationship between the countries, the internationalization of control efforts have become more relevant to technical, economic, and social fields. The control of zoonosis retains its a prominent place among the actions of international agencies according to the health and economic problems specified to each region. With this, we also know that zoonosis is an international problem. It is as well as an emerging problem also. Over the last 2 decades, there has been considerable change in the importance of certain zoonotic diseases in many parts of the world, resulting from the ecological changes such as the urbanization, industrialization, deforestation, and diminishing the proportion of persons working in so-called primary sector. So among those zoonoses recognized today as particularly important are anthrax, plague, brucellosis, bovine tuberculosis, leptospirosis, salmonellosis, even spotted fever caused by the rickettsia. We all know as the rabies and several common arthropod diseases, especially the cysticercosis, eye disease, etc. So it's really an emerging problem. In hurry, we can say that classified the zoonosis as a, according to the etiological agents. It is a bacteriological zoonosis, viral zoonosis, rickettsial zoonosis, it's a protozoal zoonosis, helminthic zoonosis, fungal zoonosis, and ectoparasitic. It can be also classified as according to the mode of transmission. As a direct zoonosis, in direct zoonosis, diseases are transmitted from an infected vertebrate host to a susceptible host by direct contact, by contact with a fomite or by a mechanical vector. So the agent itself undergoes little or no propagative or a developmental change during the transmission. It is, for example, rabies, anthrax, brucellosis, etc. In cyclozoonosis, these requires the more than one vertebrate host species, but no intervertebrate hosts for the completion of the life cycle of the agent. The example of cyclozoonosis is echinococcus and tennisiasis. Then metazoonosis. In metazoonosis, these are the transmitted biologically by invertebrate vectors in which the agent multiplies, and there is always an extrinsic incubation period before transmission to the another vertebrate host. It is very important over here. The examples are the plague and leishmaniasis, etc. In saprozoonosis, require a vertebrate host and a non-animal developmental site like the soil, plant material, pigeon dropping, etc. for the development of the infectious agent. And the examples are aspergillosis and histoplasmosis, etc. So it is according to the mode of transmission. The zoonosis can also be classified as according to the reservoir host. We can say that it is the anthropozoonosis, the infections transmitted to man from the lower vertebrate animals. The examples are, we all know that the rabies, leptospirosis, and plague, etc. And in zooanthropozoonosis, the infection transmitted from man to lower vertebrate animals. And the animals are, the examples are human tuberculosis in cattle and parrots. And in amphizonosis, infections maintained in both man and lower vertebrate animals and transmitted in either direction. So here the direction is both sides. And the examples are the salmonellosis and staphylococcus. So this is about the classification of zoonosis. Friends, we know that the prevention and control and eradication of these zoonosis are very important. So the fundamental concept in prevention, control, and eradication of zoonotic diseases is focused upon the breaking the chain of transmission at its epidemiological weakest link. It is very important here that we can break the chain of transmission at its epidemiological weakest link in the infection cycle. So the controlling the reservoirs and breaking the routes of transmission and immunization of susceptible hosts is very, very important. So this diagram, this sketch is showing the epidemiological weakest link in the transmission pathway. This is there the reservoir host we can prevent here. It's the weakest link, and after routes of the transmission, we can also this here is the also weakest link. So we can stop it through the immunization also. Regarding the prevention. Prevention of disease in an epidemiological sense means all measures to exclude disease from the unaffected population of animals. So there are three types of preventions. We can keep in mind that there are primary prevention, it is very important. And then secondary prevention and the tertiary also. In primary prevention, we include those activities directed towards the preventing exposure to the causal factors. Means we quarantine the animal or the species, and vaccination is the it comes in the primary prevention. And in secondary prevention, it includes those activities designated to detect the disease process as early as possible before clinical sign occurs. So before the occurring of the clinical symptoms, we can prevent the disease. It is known as the secondary prevention. Examples are screening test to detect the tuberculosis, brucellosis, and then the test letter and the depopulation. Friends, we all know about this photograph, this picture. It is of the mass shattered photograph of BSc in 1980 in UK. And here it is the milk test for the milk ring test. And in the third tertiary prevention, the prevention is by treatment. So this sketch is also showing the same things, the entrance of the pathogens. Then before production of the disease symptoms, we can prevent. It is a primary prevention within incubation period, or we can say the intrinsic incubation period. We can prevent the disease. This is a primary prevention. Then the secondary prevention comes before the clinical manifestations occurs, and after that, if we provide the treatment, then recovery. It is the tertiary prevention. This is about the prevention. Now, in little, I will discuss about the control. For the control strategy, which employs all tactics useful for reducing the frequency of illness which are already present in a population. So it aims to reduce the mortality and morbidity caused by the disease. So the effective control of disease requires knowledge about its multifactorial causation. Removal of the weakest link may be sufficient to control the disease. So the host specific agents are easy to control, for example, streptococcus, and the infectious agents which wider host range or the vector host may prove more difficult to control. We all know that the examples are paragonimiosis. Friends, this is the mammal snail's crab. The examples of paragonimiosis. Here we see there is an unembryoted eggs, and it is the diagnostic stage of this disease. From here, the egg is embryonated. Eggs goes to the converted into the myristidia and hatch and penetrated in snail. In snail, it will converted into the sporocytes, then radii, and then cercaria. Here we know that this cercaria invades the crustaceans and encysts into the metacercaria. This stage is infective stage of this disease. So from here, the human ingests the inadequately cooked or picked crustacean containing metacercaria. From here, the human take infection, then it will goes to the duodenum. And then in adults, in cystic cavities, in lungs lay eggs which are excreted in sputum. Or alternately, eggs are swelled and pass in the stool also. So from here, this unembryoted eggs will be passed, and it is the diagnostic stage of. So the cycle show the mammal snail crab. Regarding the eradication of zoonosis, eradication is defined as a purposeful reduction in the prevalence of specific diseases to the point of continued absence of transmission within a specified area by means of a time-limited campaign. So for the eradication, some of the countries in the world, some of the zoonotic diseases are eradicated. Eradication term is used in 4 senses. To mean the extension of the infectious disease means it is totally extinct. The example is human smallpox. Another term is reduction of the infectious disease prevalence in an area to a level at which transmission does not occur. And next we also give the terms of reduction of infectious disease prevalence to a level at which disease ceases to be a major health problem, although some transmission may still take place. So the eradication means elimination of disease producing agent from a defined population or a geographical area. It is of the total eradication means the complete removal of the agent. Example, I have also told the smallpox from the world. And the practical eradication, it is the elimination of the infectious agents from the reservoir of importance to human or their domestic animals in a defined geographical area, and making disease-free zone. It is important here to making a disease-free zone rather than the total eradication from the region. Examples are eradication of canine rabies, where the eradication of rabies from the wildlife reservoir may not be possible. We all know that. So the basic principle of disease control is, we know that there is a source of reservoir. So neutralize the source of reservoir, and then a mode of transmission from reservoir to susceptible host will be stopped, and then the susceptible transmission between the susceptible host may be stopped. Friends, we know the reservoir neutralization. About the reservoir neutralization, it is an early diagnosis. When the disease is diagnosed in early stage, then we can cull the infected animals and manipulation of the environment. Here we are, this picture, this photograph show the culling of birds during the avian influenza outbreak in Kerala, in India. And the transmission from the reservoir. So it means the reducing the contact potential. So isolation and treatment of infected animals and quarantine of susceptible animals, it's important here. And the population control. This transmission from the reservoir to the susceptible host means the increasing the host resistance through the immunization and the chemoprophylaxis. So these are some approaches employed for the prevention and control of zoonosis. These are the, in brief or in hurry, I will do the quarantine. It's a must. Quarantine, test and slaughter, environmental hygiene, mass immunization, vector control, reservoir control, early diagnosis, then treatment. And here genetic improvement is also very important. And as well as the health education, epidemiological diagnosis, unnage feeling. These are the some approaches to employ for the prevention and control of zoonosis. Just in hurry, we will discuss about the quarantine. We all know that this term is coined in the very early days, and now it is very famous because of the COVID-19. All the, even children also know the quarantine, means of quarantine. So the quarantine is the isolation of animals, or we can say the humans that are infected or suspected to be so, or a non-infected animals that are at risk. A period depend upon the incubation period, time taken for infection to be confirmed, time taken by infected animals to become uninfected. So the quarantine, we can say that the limitations of freedom of movement of such persons or a domestic animals exposed to a communicable disease for a period of time not longer than the longest usual incubation period of disease, in such manner as to prevent the effective contact with those not to expose. It's a quarantine here. The quarantine about the animals is coined by the World Health Organization, and the quarantine period of depend upon the incubation period of the agents. It's in generally it is 15 to 30 days, and the time taken for confirmation for example, isolation and identification of pathogens. Here it is the OIE is shown here, World Organization for Animal Health, because for veterinary quarantine and development of appropriate regulations applicable throughout the world is coined by the OIE, and the OIE was established in the Paris in 1924, we all know. So the international quarantine to imported cattle are to be held at the port of entry for 90 days. If we import internationally the cattle, the quarantine period is for 90 days. And in sheep and pigs, it is 15 days. And it is also worthy here to tell about the first organized quarantine on the moment of pupil was imposed by the Republic of Guernsey in 1374 on plague exposed to travelers in humans. So the term quarantine is first imposed because of the plague exposed to travelers. And in our profession, veterinary, the first international livestock quarantine was put in the use by US in 1890. The mass treatment. Friends, we all know that the mass treatment, there are some reservations. The mass treatment approaches to disease control depend upon the availability of the safe and cheap therapeutic agents. It is very important here that the therapeutic agents must be available of the safe and cheap, like the antibiotics, anthelmintics, and other drugs like the hyperimmune serum used for therapeutically. And it is also administered at the time of high risk to prevent the disease and thus to increase the productivity also. The examples are sulfonamides in drinking water for coccidiosis indicans. So the mass treatment is necessary to prevent the zoonosis. It is also very important here to tell about the selective slaughters. The deliberate killing of the minority of infected animals to protect the majority of healthy population. The selective slaughter. So the selective slaughter of diseased animal or a reactor is to be found by immunodiagnostic screening test. Here it is very important here that the screening test is very much important. First we screen, and if there is a positive case, then selective slaughter must be performed. Or the affected animals, these are the source of infection. So the slaughter yield minority of animals to protect healthy majority. It is must because of to protect the healthy majority. And it is also here very important the surveillance through the mass testing. This picture shows the mass testing or the testing of tuberculosis test, measuring the thickness of the skin. Slaughter, we all know about the affected animals can act as a source of infection in case of zoonosis, and also productivity reduces. So technically expedient to slaughter. The test and removal strategy, only reactive animals are culled, like in bovine tuberculosis. Preemptive slaughter means the animals that have risk of developing disease are slaughtered to prevent the risk of an outbreak. And it is the blanket slaughter means the animals in areas of the close contact with affected areas are slaughtered also. So that we can slaughter the animals. There are some difficulties in application of the slaughter. We all know regarding our country, there are some rules and regulations. We cannot slaughter some of the selective animals also, but in general, we can say that the high initial cost of the operation is a difficult application, difficulty to apply the slaughter. It is very important over here to know that the compensation is a very important feature also. In case of the mass slaughtering, the compensation to the farmer or the livestock owner is very important here. So it is a difficulty in slaughtering, and the high prevalence of disease. Replacement stock is another problem. This is also a picture of the same avian influenza. This is the news of the Indian Kerala. Kerala ordered culling over the bird flu fears. This is the 2014 about in the Kerala or in India about the bird flu. So these are the some ducks and chickens after lab testing found bird flu strains in the dead poultries. So more than lakhs birds has been sacrificed at that time. So there are some important examples of the sacrifices, slaughters or mass slaughterings. So our 1,50,000 ducks had died at the Talavedi and the Purukedi in the Kuttant area of the Alpajua district during the first 2 weeks of November 2014. The test samples of the dead birds conducted in an high security animal disease laboratory, that is HSADL Bhopal, and had confirmed that the avian influenza was the cause of death. Then these animals were sacrificed. And the team of the Rapid Response Force, comprising personnel of the Animal Husbandry Health Department, started culling of thousands of ducks. Near more than 2 lakhs ducks have been also culled within 1 week after the outbreak of H5N1. We all are aware about this infection of the Kerala. So there are some, the government at that time decided that the state government announced the compensation of Rs 100 for birds that are less than 2 months age, and the birds of old means the age of birds are older than 2 months. The compensation was 200 rupees at that time. These are some photographs of the avian influenza virus outbreaks in Kerala, November 2000. This is also. That is again the photograph which we all know about, this mad cow disease outbreak in UK in 1980. It is very important for the controlling of the disease. Hygiene is very important. So hygiene and control of the environment is again important. So friend, the first public health measure to be applied on population example is protecting the public water. And implementation of farm hygiene practices improve sanitary environment of animals. It's also important. And the sanitary control of animal slaughter. It is a critical supervision of animal slaughter provides excellent opportunities for early detection of livestock disease in the area. Hygiene, we all know the sanitary control in slaughterhouses is very must. Proper ventilation, clean water in farms, pest control, improvement of housing, and general cleanliness is again important. And there are rotational grazing of the pasture is again having a very important role, and proper disposal of the dead animals. This is the photograph of slaughterhouse. Here is the mass immunization. We all know the mass immunization. Immunization reduces the number of susceptible animals in the population, augments herd immunity. So an immunization program must be, before starting the mass immunization, we can keep in mind some important points. Like it have a epidemiological relevant. Before starting the mass immunization, we can keep in mind about the epidemiology, and it is also important here to immunologically effective. The mass immunization must be immunologically effective, operationally feasible, and socially acceptable. That the socially acceptable is a very important. Before starting the any mass program or mass immunization, we must aware the farmers or the livestock owners to tell about their benefits, and then start the mass immunization, so it will be socially acceptable. Vaccination, we all know that we can differentiate the 3 types. It is a strategic vaccination, means to prevent the incursion of disease from endemic areas. Emergency vaccination, we know at the time of an epidemics, it is an emergency vaccination, and ring vaccination, we know the around the infected areas at the time of outbreak, like in FMD vaccination, we are doing the we do the FMD ring vaccination. But nowadays, Government of India has taken initiative to vaccinate, to reduce or to about the FMD. So here, this is the importance of vaccination. We all know, friends. This picture shows the real importance of the vaccination. So in public, when we go in public, we can say like this, that we can educate the pupils. So this picture shows there are two, no one is immunized, and two persons are infected with the contagious disease, and it will convert it to the contagious disease is spread throughout the population. We are seeing over here. And in second case, some of the population gets immunization. There are six people get the immunization, and the contagious disease spreads through some of the population. Contagious disease, these 6 people are immunized, and the other population get the disease. And here in last, most of the population get immunized, and the spread of the contagious disease is contained. So this is the effect of the vaccination or immunization. Nowadays, we are also hoping for the COVID-19 vaccines. This is the importance of the vaccination. There are some vaccines like aerosol vaccination were tried to experimentally against the pneumonia and the anthrax, and some other oral vaccines or wet vaccines are also available against the rabies. We know about it. This is the rabies vaccine bed. Niche filling, friends, we know that the presence of one organism within a niche can prevent its occupation by another organism. So this is a epidemiologically interference investigated experimentally in the poultry industry. Suspensions of the indigenous intestinal microbes fed to one-day-old chicks to prevent the colonization of their digestive tract by virulent salmonella species, Campylobacter jejuni, and the E. coli also. So this technique of the control has the advantage over the prophylactic antibiotic chemotherapy, that antibiotic resistance is not encouraged. So this is the another important phenomena. About the control of vectors, the biological vectors, we know the infectious diseases transmitted by biological vectors can be controlled, removing the vectors. Insect vectors can be killed with the insecticides. And control of mechanical vectors, we know the living organisms that mechanically transmit infectious agents can be controlled by the destruction and disinfections. Examples are, we know the equine encephalitis, know the destruction of mosquito, and it is leishmaniasis. It is due to the sand fly. These are some methods of the control of vectors. We know about all, so we don't discuss in detail. Environmental measures, so source of reduction and drainage operations, planned water management, and proper disposal of waste. Chemical measures, we all know that the contact with natural and synthetics, these are also important. These are some pictures of the of these. We also know about the biological control. It is fungi, protozoa, bacteria, genetic manipulations also. The reservoir control is also very important over here. It will be discussed in little. So friends, the reservoir is defined as any person, animal, or non-living things in which the infectious agent live and multiply and can be transmitted to a susceptible host. It is the reservoir. So the reservoir control is applicable when a population of expandable wild animal act as a reservoir for an infection. It's helpful against the rat, stray dogs, and other noxious reservoir, as for leptospirosis, rabies, plague, typhus, etc. In wild animals, we know the poisoning, poison baiting and the trapping is widely used. Isolation and treatment of domestic animals is also important, and rodenticide and fumigation is also important. Here I have earlier also told the early diagnosis for the control of zoonosis is very, very important. So to assess the presence of disease and to establish the pathogens involved, early diagnosis is very important. So for early diagnosis, we do the, for brucellosis, we do the agglutination test, that is complement fixation test, in glanders, the Mellin test, leptospira, the microscope agglutination test, in rabies, the fluorescent agglutination test, and tuberculosis, tuberculin test, Newcastle disease, HI, and swine influenza, it's a complement fixation test. These are some photographs of fluorescent agglutination test in rabies, and it is the tuberculin test. Genetic improvement. It is worthy here to discuss about the genetic improvement also. So the incidence of some infectious diseases can be reduced by selective breeding. Examples are breeds of the cattle in the Chestes zone of the Africa and Dama breed tolerant for the trypanosomiasis. And we also know about the FMD and TB in Angola and HF cattle of India. These are the some genetic improvements which were do through the selective breeding also. Here we can discuss little bit about the health education. We all know, we very well know about the health education, but we are very much not aware about the health education. So the friends, the health education is a most effective preventive device, not only in man, but also in diseases of lower animals, where educating the owner is of a paramount importance. So it is our duty, it is our moral duty that we can educate the owners, livestock owners, the farmers, and the others about these diseases. It is also important to educating the community about the cause and mode of disease transmission, prevention and treatment of disease. And the education helps create a cooperation and participation of the public in fulfilling the goal of disease management. That I have already earlier nourished, that the public participation is very important. These are some photographs of the health education. The PGIVAS fellows from the project of Center of Zoonosis, we are providing the education to the school teachers as well as the students regarding the zoonotic diseases. These are the awareness programs of our Center for Diagnosis, Surveillance and Monitoring of Zoonotic Diseases in Rajasthan. These are some photographs. We are providing some pamphlets or print materials to the students. We are also teaching, giving education to the teachers, school teachers, college teachers. These are some photographs of the project activities. We can also educate through the observing the days like the World Zoonosis Day. At that we can also educate the pupils, or on the World Rabies Day. So friends, epidemiological diagnosis is very important. The frequency and patterns of the disease occurrence are quantified with possible determinants. It is very important here for the removal or the prevention, control, and eradication of disease, the epidemiology, to know about the epidemiology of the disease. So the epidemiological intelligence and epidemiological analysis are used for these purposes. To determine immediate and long-term needs for purposeful action against the disease. And epidemiology is also helpful. It helps in the developing appropriate approaches against emerging infectious diseases. Now we will discuss about the brucellosis. Just within 2 minutes, I will start the epidemiological surveillance. We know these are the simple things, but very important. So, main tool of epidemiological diagnosis help in identifying the priorities for long-term actions against the disease, to keeping the field level personnel informed facilities. This diagram is also showing the host, environment, and pathogen, and here is the disease. This also factors influencing the veterinary diagnosis. Here are some points regarding the prevention of zoonotic diseases in human population. So we will keep in mind that the high risk groups population must be protected from the occupational zoonotic diseases. For example, anthrax and leptospirosis. It can be achieved through the following measures, like the health education that we have discussed, personal hygiene has discussed, protective clothing we discussed, immunization we discussed, and about the regular testing and reducing the contact potential. Also improving the social customs, norms, conditions of the lifestyle, early diagnosis, it's important, and the isolation and therapy is again important, and keeping the environment hygiene, and regular anti-mortem inspection animals at the slaughterhouse following the consumer protection strategies. It's a very important because of the HACCP. And the coordination between the medical, veterinary, and public health personnel is very important. And notification and reporting disease and outbreaks is important. And disinfection and sanitation and public health awareness we have discussed earlier. There are some factors involved in the disease control and eradication programs. So we will discuss about little bit about the veterinary infrastructure. It is very important to discuss over here that the veterinary infrastructure is playing very important role to eradication of the diseases. So the strengthen the diagnostic feasibilities, adequate surveillance is provided, availability of the replacement stock is very important, and producers' opinion and cooperation is very important. We have discussed all these points earlier. Financial support, ecological consequences. These are some another photographs of we are giving education to the farmers. So regarding the veterinary infrastructure, the three main components are very important. These are the mobile field service comprising of adequately trained veterinarians and veterinary auxiliaries. It's important here. And adequate diagnostic facilities and research facilities is required. In diagnostic feasibility, we know that it is very important. The disease should be promptly recognized. Adequate surveillance is very important. There are three components. The data collection from the field, clinics, slaughterhouses is important. And then the processing of these data and analyzing local and state level and national level, it's important. And then prompt feedback, this is very important phenomena. After processing and analysis, the prompt feedback is very important here for the zoonotic disease purposes. So to program and planners, implementation purposes. Producers, public opinion, it's important phenomena. Public health considerations we have already discussed, and some legislations, these are required. So the general objective of zoonosis control is we discuss about all these we have discussed. Friends, thank you very much. The operational phase in zoonosis control are there. Now these are the surveillance, control in animals, control of infective media, prevention in man, and strategy selection. Now we will discuss about the brucellosis. So the friends, we know all about this disease. I will discuss some important points. Brucellosis is an infectious disease caused by bacteria, we all know. And the Brucella species or the genus is of aerobic non-motile gram-negative Coccobacilli. So the people can get this disease when they are in contact with the infected animals or animal products contaminated with the bacteria. So the animals that are most commonly infected include sheep and goat, cattle, pig, and dogs. Globally, I want to discuss about about the global scenario of this disease. the global burden of human brucellosis remains enormous. The infection causes more than 5 lakh infections per year worldwide. So the disease occurs worldwide, except in those countries where the bovine brucellosis, that is the bovine abortus, has been eradicated. In these countries are the Australia, Canada, Cyprus, Denmark, Finland, Netherlands, New Zealand, etc., and United Kingdom also. On the other hand, the Mediterranean countries of Europe, Northern and Eastern Africa, Northeast countries, India, Central Asia, Mexico, and Central and South America are especially affected with this disease. So while Brucella melitensis has never been detected in some countries, and there are no reliable reports that it has ever been eradicated from the small ruminants. Regarding India, the presence of brucellosis in India was first established early in the previous century, and since then has been reported from the almost all states. So we can say that the epidemiologically evidences show that in India, brucellosis is present in different species of mammalian, farm animals, including cattle, goat, buffalo, yak, camel, horse, pigs. So the brucellosis in cattle seems to be associated primarily with intensive farming practices in large organized dairy farms and goshalas also. And the risk behavior such as the unrestricted trade and movement of the animals, use of local cattle yard and fair for trading, sending of dry animals back to the blaze for maintenance, and use of semen from the unscreened bulls for artificial insemination, and poor farm hygiene probably all contribute to the spread and transmission of this infection. The free grazing and movement with the frequent mixing of the flocks of sheep and goats also contribute to the high prevalency and wide distribution of brucellosis in these animals in India. So friends, increasing demand for dairy products and protein, changing agricultural methods, and increasing trade and movement of animals have caused concern that the prevalency may increase. Therefore, there is an urgent need for the strict implementation of control policy, not only for cattle, but also for small ruminants. Given the potential huge economic and medical impact of control policy could be cost effective. So we all know that India has already a policy for control of brucellosis in dairy cattle in India. As we know about the agents, we know that the agents are Brucella organisms. We know there are 8 species, but 4 are having moderate to significant human pathogenicity. These are the Brucella melitensis. It is the highest pathogen. It has the highest pathogenicity. Brucella suis, it's a high pathogenicity. Brucella abortus, it has a moderate pathogenicity, and Brucella canis. Source of infection, we all know that the animals that are commonly known to serve as a source of human infection are goat, sheep, cattle, buffalo, swine. Infections of the reindeer, caribou, camels, and the yak is of epidemiological importance in some part of the world. So the dogs have long been known as a carrier of Brucella, and the newly recognized species Brucella canis, not newly. So Brucella canis may be transmitted from dog to man. We know all that. This the diagram show that from cattle we can take the infection from goat and sheep, from swine and dogs, and from the unpastured or milk. Without boiled milk, we can take the milk directly, or from the slaughter, or the veterinary care, or with a vaccination accident, or a laboratory accident with culture also. These are the Brucella clinical presentation. Here need not to discuss about the history, but it is important here for the diagnosis purposes, especially in human. The history is very important. A careful history is the most helpful tool in the diagnosis of brucellosis. The history means the history should include both assessment of any risk factors present and evaluation of any symptom reported. So unless exposure to the brucella is due to weaponized attack, almost every cases of brucellosis involve exposure to an affected animal in some fashions either directly or indirectly. So the brucella has been potentially to be used as a biological weapon, we know, but to date these organisms have not been implicated in any major bioterrorism incidences where they are used in such a way. However, in non-endemic regions and in endemic regions, physicians, veterinarians, pathologists, laboratory personnel exposed to tissue from infected animals, including humans, are at the particular high risk of brucellosis. These are some symptoms in humans. We know that the fever is the most common symptom and sign of the brucellosis, occurring in 80 to 100% cases. Fever, and it is intermittent, we know, in 60% of the patients with acute and chronic brucellosis, and undulant in 60% of the patients. We all know about the synonyms of this disease are the Bang disease, brucellosis, Cyprus fever, Gibraltar fever, goat fever, Meliten's fever, undulant fever, etc. So the fever can be associated with the relative bradycardia also. Here, in case of fever, it is also relative to the bradycardia. Means the decreasing the heart rate also, and fever of unknown origin. It is very confusing here. In the human being, the brucellosis is not diagnosed earlier because of the fever is unknown origin, and is a common initial diagnosis in patients in areas of the low endemicity. So it is associated with chills in almost 80% of the cases. In case of fever, chills. Chills is almost in all the cases, more than 80%. So the constitutional symptoms of brucellosis include anorexia, asthenia, fatigue, weakness, and malaise, and weight loss are very common in more than 90% of the cases. And in case of the without diagnosis, it is go longer. It is when it is become chronic. The bone and joint symptoms include arthritis, low back pain, spine and joint pain, and rarely joint swelling. These symptoms affect as many as more than 50 to 80% patients. Arthritis may be diffuse or localized with a predilection of bone and the sacroiliac joint also. So the acute monoarticular arthritis is uncommon but may be part of the presentation. It is here important that in case of chronic case, the neuropsychiatric symptoms of the brucellosis are common despite the rare involvement of the nervous system in early stage. And the headache, depression, and fatigue are the most frequently reported neuropsychiatric symptoms. In patients with advanced diseases who have meningoencephalitis, these complaints may include the change in the mental status, coma, neurological defect, rigidity, and seizures also. Categorization, we know that it is of the subclinical it is of the subclinical brucellosis. It is acute or subacute. Means the sudden onset over the period of 1 to 2 days. It is subacute. The symptoms develop over the course of a few weeks, or it will be a chronic also, or a localized and replacing brucellosis. So friends, there are, if it is diagnosed properly, brucellosis is diagnosed properly, that it can be treated. Otherwise, there will be some complications also. So the complications are rare in the patient who is treated appropriately. Though the relapse of infections may occur in 10% of the patients, the major risk factors for the development of the focal complications is symptom during the greater than 30 days before the diagnosis. And the most common focal complications fall into the following categories, like the osteoarticular, the osteoporosis may occur, or hepatobiliary infection of the liver abscess also may, gastrointestinal GIT involvement also, and genitourinary, as we all know about the genital involvement of this disease. Neurological signs also appears, cardiovascular, pulmonary, and hematologic complications may develop later on. So the diagnostic consideration is very important. The sign and symptoms of brucellosis can be non-specific and can mimic those of many other diseases. Therefore, meticulous attention is needed to making the diagnosis and in treating patients. The primary diagnostic pitfall is failure to consider the possible brucella infection in a patient with history that suggests a possible source of infection. That is that may be a farmer or a traveler to an endemic region or a veterinarian. So in addition to the conditions listed in the differential diagnosis, other problems to be considered include the following. These conditions are also confusing with this disease. These are the collagen vesicular disease, fever of unknown origin, malignancy, rickettsial disease, vesiculitis, etc. We can also discuss about the differential diagnosis about these diseases. These are listed here. I think time is over. So in hurry, we can discuss about these are the diseases which properly differentially diagnosed. Laboratory study is very important regarding the complete blood count is necessary for diagnosis of the brucellosis. That is, anemia is reported in 75% of the patients, particularly with chronic infection, and thrombocytopenia is reported in 40% cases. Regarding the liver enzymes, we have also discussed about this. These are the R sites. It is very important for the diagnosis purposes to culture the organism. So the diagnosis of brucellosis is definitive when the brucella organism are recovered from the blood, bone marrow, or other tissues. Some brucella species require 5 to 10% carbon dioxide for primary isolation. Because of the ease of the aerosol transmission, any potential brucella specimens should be handled under a biohazard hood. It is very important here. All the participants who are handling the brucella organism, please take care always. The serology is very important. Serological testing is the most common used method of diagnosis brucellosis. Repeated serological testing is recommended if the initial titer is low. We know it's about the tube agglutination test developed by the Brucey. That's why it's known as the brucella. Measures antibodies against the smooth lipopolysaccharides. It remains the most popular test tool for the diagnosis of brucellosis in earlier. And the 2-mercapto ethanol test detect immunoglobulin G, that is IgG, and the titers higher than 1:80 defines active infections. So a high IgG antibody titer or a titer that is higher after the treatment suggests persistent infection or a relapse. It is very important again here. So the other tests such as the TAT and other modified TAT are also popular. And there are some latest techniques are also implied for the diagnosis of brucellosis in humans also. That is the enzyme link immunosorbent assay. We also know the ELISA that is typically used to cytoplasmic proteins as an antigen and measures IgM, IgG and IgA, allowing better interpretation, especially in case of brucellosis relapse. Friends, the polymerase chain reaction is very important again here for the proper diagnosis of the brucella. That's the PCR test have been developed for the detection and rapid diagnosis of brucella species in human blood specimens. So there are two major genetic targets on which we are doing. That is the brucella gene BCS SP31 and the 16S23S rRNA operon. So this is about the little bit about the brucella in humans, and it is also important here. Sir, unmute please. Other promising tests include nested PCR, real-time PCR, PCR ELISA, but the clinical roles for all these tests remain to be different. About the treatment, we all know that doxycycline, gentamicin, streptomycin, and rifampicin are taking for the treatment of this disease. Regarding the brucella in animals, it is very important here that this infection in animals caused by the Brucellosis species frequently results in abortion and diminishes the level of milk production, we all know. On the acute period of disease is over, animals may present with little or no disease symptoms, and Brucella cells can chronically be located in the supramammary lymphatic nodes and mammary glands of 80% of the infected animals. It is important. Thus, the animal continued the source secret to the pathogens in their body fluids. In prevention and control in animals, it is we are all know that the vaccines are available. Some killed vaccines are available, and the live vaccines. The very important vaccine which is available in India, the Brucella water strain 19 is available. It is given at the age of 4 to 8 months, or we can say 2 to 6 months also. 5 ml dose intra subcut. This strength will be given to the female calf. And there are some vaccines not available in India, but in abroad there are some vaccines are also available for adults. So this is about the brucellosis and regarding the general awareness of the zoonosis. Thank you very much, sir.